Hey, it's Patty. I just wanted to take a few minutes to talk about why we use the zebra as an analogy and a mascot for those with Ehlers-Danlos syndrome. So I'm going to talk a little bit about the history and also talk a little bit about zebras too. So historically, back in the mid-1900s, this doctor, Dr. Theodore Woodward at the University of Maryland, was teaching medical students and started using the terminology. So we think this is when it came from. When you hear hoofbeats, think of horses, not zebras. And by the 1960s, this was something that was being used by a lot of different medical schools and teaching platforms um, with hopefully good intentions to begin with, but again, when you walk away with just that phrase and nothing else after that, it can be detrimental to some patients. However, when those that are in pre-med in medical school are starting to learn all this information, it is a lot to take in. You're learning about so many different pathologies, so many different systems. It is a lot to learn. So when you get plopped out into clinical practice and you're trying to remember everything about every system, and somebody walks in front of you, this is really meant to help focus students into ruling out the typical things that we would expect from what somebody is complaining about before moving on to something else. And I think the before moving on to something else is where things might have been forgotten. It's that zebra next. What are the hoofbeats if it's not a horse? But really understanding that the idea of this was to help with life-threatening pathologies that people had, and also just improve efficiency in treatment, hopefully reduce time in searching for a diagnosis that was out there for an individual that was a horse that was dealing with stuff, and you could hopefully improve a life. So there's well-meaning behind it, but again, we have to remember that not all hoofbeats are going to be a horse, right? So it really does make sense, right? If we have a horse that walks into the office, the zebra is going to be overlooked, especially when somebody is looking for only horses. Now, if a zebra is labeled as a horse and receives treatment for a horse, it might not help. It actually might help in some cases. So treating zebras can be different, but not always. And we have to remember that, right? So we want to make sure that we're giving them the right help for the right condition. So in other words, if we're talking about horses and horse treatment, if you have a zebra and a horse that both walk in with a cold, which is the horse's problem, that horse treatment might be helpful, right? So we don't necessarily want to lose the idea of helping the horse. However, when we have certain things, as an example, not just this, but as one example, tethered cord in the general population and tethered cord in our zebra population, they're different. One of them is very much an anatomical only problem that's very much reducing what's happening. But when we look at our zebra population, we have this neuroimmune inflammatory event that's happening. It's different than the tethered cord that we typically see in the general population. So if you then take a horse treatment for tethered cord and try to apply it to our zebra population that has a zebra tethered cord, they might not have the same benefit from treatment. So that's where sometimes a horse treatment can be very helpful if you're dealing with a horse problem. But if your zebra is having a zebra specific problem, they need zebra treatment. Okay, so yes, we should always think horse first when you hear hoofbeats, but if a horse doesn't seem to be standing in front of you, the next step is we have to think what else makes hoofbeats, and could it be that? Okay, so we just want to make sure that the patients are getting the right and appropriate care that they need for the conditions that they have. That's thinking outside the box. So about zebras in and of themselves, they're actually pretty neat for those that have looked into zebras. Every species of zebra has a different appearance to the stripes that they have. They can be thin, thick, vertical, horizontal, brown, black, different variety of colors depending on the subspecies that they're in. So everybody's a little bit different. Besides the group differences that they have, every particular zebra has a different pattern of stripes, just like every zebra in our dazzle has a different collection of symptoms and diagnoses. Just like our fingerprints, every zebra stripes pattern is unique, just like us. And again, every patient is going to be unique in their presentation and they're going to need that specialized horse and zebra care when appropriate for the condition that they have. Also, zebras tend to stick together. They're very social and supportive within their species. They form small groups or harems, typically with one male, multiple females, and younger offspring. The younger males that are without a harem will actually group together until they're ready for their own harem. So there is a lot of bonding within this species. And then the harems will also combine forces into larger herds if and when needed. So there's just a lot of overlap, I feel like, between all of our personalities with the zebra and ourselves as humans. The herds will change their pace if needed, if there's a slower member, or they'll stop to look for lost members too. I feel like that's us as well. Biopsychosocial care is really the gold standard for hypermobility spectrum disorder and EDS in itself. So we really have this platform of understanding community and this psychological wellness with ourselves and the people that we communicate with, kind of just like our zebra herd out there. The social piece of connecting with others that have connective tissue disorders can really be a valuable support and source of tips, tricks for self-care. So going back to our herd, that's where I really find um, asking for advice on things, not opinions, but just advice on what might have worked or support through other individuals this is really, I think, our strength within our community. There's a lot of different support groups that can be found online. And also Ehlers-Danlos.com is a wonderful resource, has a lot of information about those affiliated groups, different support groups as well. So we really want to make sure that we're supporting each other, supporting ourselves within our herd, and trying to educate others on the fact that we can coexist as horses and zebras, and as long as our zebra uniqueness is recognized when needed for appropriate treatment. Thanks for listening.